One thing I wish I'd learned sooner, which I'm happy to pass on now, is you need to make sure they own the problem and even the words you use, okay? So there's not a decay in the tooth, there's decay in your tooth. Once you get the license, right?
Yeah,
you don't learn how to drive as you're doing the driving lessons. It's only after you get the driving license do you learn. That's why it's called the practice of dentistry.
I've spoke about this before, you know, dentists actually putting a clamp on the tooth just for the radiograph so that it looks like they were using rubber dam, but they weren't. So yeah, I think that's really interesting.
Like for me, I can't even like go to sleep. I can't even like, my stomach like turns when you say things like that. So, you know, you could easily get into this habit of just constantly cutting corners and then you normalize it, right?
Yeah,
so please, everyone listening, everyone watching this, don't normalize, not even mediocrity, but like substandard care. Don't normalize. Yes, you'll see more patients. Yes, it might mean you make more money or whatever, but in the long term, honestly, it's going to be a detriment, because if you do things by the book and if you do things properly and you're proud and you go to bed at night saying, you know what, I promise you, patients will be willing to pay for high quality dentistry in the future and you'll be the one to be able to provide it. I remember being on an ortho clinic as a student and one of the tutors told me this piece of advice and it's just always stuck with me. She said that becoming a dentist or getting a license or a degree is kind of like driving. Like when you get a driving license, that doesn't actually mean you've learned how to drive. The real learning only really begins once you get your driving license. Once you get in those real world scenarios, once you get those impatient drivers tailgating you, when you encounter drivers like the ones that live in my neighborhood that never indicate, or having to deal with your first ever accident. And so similarly in dentistry, all those real life problems, only learn to deal with them once we qualify. And that is what this episode is about. Now, if you're starting your journey in dentistry, maybe you just qualified or fresh graduate, wow, this episode is really gonna hit hard for you. But for us oldies out there, those with a bit of experience, this will be such a relatable episode. It'll be a trip down memory lane, reminiscing about your journey into dentistry, but also you'll actually realize how far you have come. And of course, there are a few things that will always be a bit of a struggle and you might be able to resonate with them, and you never know. You might even pick up a few tips that I shared with Emma that you might be able to implement in your practice and become 1% better tomorrow. That is, after all, the ethos of Protrusive Dental Podcast. Now, if you're new to the podcast, hello, it's great to have you here. You got a whole load of catching up to do. And if you're a regular Protruserati returning, thank you so much. My name is Jazz Galante, I'm your host. And every PDP episode, I give you a Protrusive Dental Pearl. And for those of you who've been with me for a long time, you'll realize that actually this is the point where I always stutter and I always have to pause and think, bloody hell, what pearl am I going to give today? It was easy for the first 100 or so. I'm kind of running out of pearls to give. I'm pretty sure I've recycled a few, so let's give it a good shot. So today's protrusive pearl is a communication one. It's great for the younger dentists to make sure they practice this, and it's also a really good reminder for the experienced colleagues who perhaps maybe sometimes may take this for granted. The pearl is, when you're communicating with patients, predict the complication before it happens. Now, what I mean by this is when you do a large restoration, maybe it was an elevated risk of needing a root canal or pulpitis because of the depth of the restoration, or maybe there was a crack inside. Now, I know it sounds obvious, but we should be warning our patients that, hey, this tooth had a very big hole, or this tooth had a nasty crack, and hopefully you're showing images at this point, and then say something like what most people would experience is a twinge, perhaps to cold, sometimes hot as well, and that can linger for a few days. That's because the nerve has been upset from the decay or the crack that was there before. Please, Mr. Patient, continue to take your painkillers and clean your teeth and gums really well. Now, you may get a severe throbbing ache keeping you up at night time. That's a sign that your nerve's dying, basically. At this point, you need to call us, especially if it's giving you pain out of the blue, unprovoked, without a drink or without eating anything. See, all those are signs that the nerve is too far damaged. Most important thing to remember, like I said, is painkillers. Keep it clean. There might be a bit of bruising around the gum. That's where the filling was quite deep. So you might feel a bit sore when brushing as well. Just take it easy. And if anything lingers at the 2-week mark, you can always call us back. We're here to help. Now, I know it sounds really, really obvious, but when you forget to do this, or when you underplay it, that's when the receptionists get those phone calls that they pass on to you. What I also like about this is that it's warned them about something that you would have already pre-warned them about, which is the whole loss of vitality or irreversible pulpitis or needing a root canal. You see, if and when that complication happens, you now look like the expert. Whereas if you didn't warn them, if you didn't actually give it a name or describe it, then it seems like, ooh, something's gone wrong, something's not right. But actually, you knew all along it was a known complication, and so it's important to communicate that to our patients. I remember early in my career, I'd be almost scared to tell my patients that they might get throbbing ache disturbing them at nighttime. They might might need a root canal. All these things were scary things, like very negative things. But actually our patients deserve to know. Now, thankfully, my rate of my patients needing root canals after deep restorations is pretty low, and I get very few, if any, post-op complications like that. But I still tell my patients all the time, and you really do come across as the expert, and the number of calls we get back to reception are very low, and I've just reduced my risk profile going forward. So that was a useful reminder. Let's now join the episode with Dr. Emma Hutchison. She's now qualified. I'm gonna cry or something because when I found Emma, she was a student. We started the Protrusive student series, and it's so great to see her grow up into a dentist, starting from her nursing background. So Emma, we're all, as part of Protrusive, on the behalf of Protrusive, all the Protrusive, we're really proud of you. Let's now hear all the things you're about to learn now that you are qualified. I'll catch you guys in the outro. Emma Hutchison, welcome back to the Protrusive podcast, our Protrusive student. It's been a while since we recorded. In that time, you've been embracing final year. You're in your final weeks of dental school now.
I know.
How does it all feel?
It feels a bit surreal, really. I'll be going for interviews over the next few months to start at practice in September. So, but it's good though. It is really good. Where I'm put in placement at the moment is a little peninsula off of Scotland called Campbelltown. It's actually closer to Belfast than Glasgow.
Wow.
So they put us on a plane at 8 a.m. Monday morning. The uni flies us out there. It's about a half an hour flight, a very tiny plane that you can't even stand up in. It's really quite scary. And then we see patients Monday to Thursday. They put us in an Airbnb on a farm. And it's really, really cute. They've got lambs and things at the moment. I can send you some photos actually.
This sounds
really
like a
nice.
great experience.
Yeah, it's I think Glasgow has a really good outreach program. So they put us into groups of 4 and we go through blocks throughout the year. And then we get a flight home on the Thursday evening. And then we get the Friday off, which is good.
This is amazing. Two interesting things I remember from being final year is that I could not see past, like, that whatever date is your last day of uni, like life after uni, I couldn't visualize what it would look like. I couldn't because at that time we didn't know what our placements were as well. So because you don't even know where you're going to be next year, like it's difficult to imagine life after dental school. Is that a similar feeling you can relate to?
Yeah, 100%. I think it helps a little bit that I've got that background in dentistry, but it is a bit unsettling. In Scotland, it's a little bit different down in England. So in Scotland, you go for face-to-face interviews, and the trainers will rank their favourite students that they've interviewed 1 to 7, and we rank our favourite practices 1 to 7, and an algorithm sorts you out. So a lot of people do go into clearing, but it's not a bad thing. Like a lot of people end up going to clearing just the way the algorithm works. But, I would like to be close to my mum and dad in West Lothian in Scotland, but I could be in Inverness. You never really know. So it is a bit unsettling not knowing where you're going to live next year, who you're going to be with, who your trainer's going to be. But yeah, I suppose that's all the fun of it.
It is. And the other thing I remember is, I don't know if I'm making this up, but I feel as though towards the end, because now you've already passed your exams and everything, it's just like a few weeks left. How are your motivation levels? How are your energy and motivation levels? Or are you just itching to finish now and move on and you overstayed your welcome kind of thing? How do you feel in that regard?
I think, see, at the beginning of the year, I remember saying to you, Jazz, I'm going to try and not wish away this last year and just try and enjoy it. But I have to say the last few months, everyone's attendance is slipping. I think people are just, because we've been here for the 6 years rather than the 5 years. I think we're all just not ready and competent to go out and be dentists. Obviously, there's still a huge learning curve to come. But I'm more and more excited to be out of a university environment and in my own wee room in a practice, in a high street dental practice, and seeing what it's all about. But yeah, I think that, there's been a lot of attendance meetings going around uni and people getting called in about their attendance. Not me, thankfully. But yeah, I think
never in doubt.
I think it is wearing a bit thin and just they're itching to get out there now, which is good.
I can definitely relate to that. So Emma, today's episode, what are we going to talk about today? How can we help the community of students that listen to Protrusive and also dentists that return and just they like to listen to these topics that remind them of their time as a student, or there are always some things to pick up in any episode we do?
Yes, tying in nicely with that, we had spoken before about talking about the things that dental school doesn't prepare you for. And it's something that I'm starting to think about more and more. And a lot of my friends at uni will ask questions, how do you even get paid when you get out there, and this, that, and the next thing, all the things that dental school doesn't teach you. Again, I think I'm a little bit more fortunate that I've had that background in dentistry. I've seen things. But still, there's a lot of, a bit apprehensive to get out there and do it yourself. So we're just going to talk about, what dental school doesn't prepare you for.
Well, I'll give you a broad answer first, and then you can just hit me with more direct ones. I think there's a recurring theme on this podcast that people may perceive that I bash dental schools, that I say, oh yeah, occlusion wasn't covered, this wasn't covered, TMD wasn't covered, and I say that a lot. But I think a lot of credit should be given to dental schools, as long as you remember that the role of the dental school is to make you a safe beginner. And I've said this time and time again, probably the 20th time I'm saying on this podcast, is someone once taught me on an ortho clinic in dental school that you only really learn how to drive a car. I think probably we discussed in the first ever episode, is once you get the license, right?
Yeah,
you don't learn how to drive as you're doing the driving lessons. It's only after you get the driving license do you learn. That's why it's called the practice of dentistry. So as long as you're going with that mindset that actually you are still a sponge, the learning has only just begun, which can feel a little bit daunting because, like, you've got 6 years worth of books and exams, and for me to say, hey, the learning is just beginning, that can be a bit of a slap in the face. But what I've noticed so far, the most engaged dentists, the happiest dentists, the most fulfilled dentists, they don't stay stagnant. They keep learning. They keep doing either a master's program or a diploma or a cohort course, or they decide that, okay, now this year I'm going to focus on being better at onlays, or this year I'm going to focus on veneers, and they keep going and bettering themselves, even if it's 1% every day, or even just 10% in a year, right? And it all adds up. And I find those dentists are the most engaged. So there is so much that dental school doesn't pay for, from deep dives into things like, I remember having 4 lectures on waste management. 4, right? And then very few on actually the practical occlusion aspects, right? And that's how it is, right? So you're going to have knowledge that you're just never going to use, or very difficult to actually use in the real world. But that's okay, it's some there, you might need it one day to recall it, and that's fine. But just go in there with a safe beginner attitude and use and have confidence in yourself that you can do this, but equally keep asking mentors and your trainer, and have this community. For example, it could be a Protrusive community or any community, just to keep bouncing. It can be a WhatsApp group. It's so nice to be able to just ask questions. So don't lose that inquisitiveness. Keep asking why, how, and the other thing that dental school doesn't prepare you for is the onslaught of what you see on social media. Because this is a very dangerous thing, social media, actually. Back in my day, I sound so old now saying back in my day, right? Back in my day, like, the only thing you ever share on Instagram was the pasta you ate, right? And now there's dentistry everywhere. For the algorithm recognize you're a dentist, you get beautiful dentistry, you get all sorts of dentistry thrown at you, and you're disillusioned and you start wanting to do things that way. But that takes a long time to get to that level. So don't be disillusioned. There's so many clinical things that you're going to learn more and more of. And so keep learning, keep going on courses to better yourself. And then communication, right? You need, and nowadays, what a time to be alive with AI and whatnot. You can actually have AI to record your transcript or generate a transcript for you. You can feed that into AI and ask, okay, rate my communication. Tell me how to be a better communicator. It's like having your own personal coach on your side to train you. So let's make use of all these opportunities that the new generation have. So that's my big broad, okay, you're just a safe beginner, but see it as a opportunity to grow and utilize the latest technologies to do so. So that's my big broad one.
Okay, perfect. And just touching on that at the beginning, when you said, the happiest dentists, they're not the ones that stay stagnant. So what was that for you? Like, when you get into practice, a lot of things can seem very intimidating. What was it for you that sort of caught your attention? You want to delve more into that? Did that change over the years? What did that look like for you?
First couple of years for everyone, it's pretty much going to be the same, okay? It's just getting better at the daily things you do. For example, every day you give a buccal infiltration for an upper molar or something. How can you make it more effective? How can you make it more painless? How can you do it in a slick way? Just mastering something so basic goes a long way. How to make sure that you're assessing your radiographs properly before an extraction, and then therefore knowing when to refer and knowing when to do it, and maybe having a mentor just next door in case you get stuck and tell them, hey, I've got a tricky one. I'll give it a go, give my best shot, but just have my back in case I need you kind of thing. Maybe block off half an hour and having that kind of conversation. So just becoming good at your bread and butter dentistry. So this is basic restorations. Class 2s, which it sounds simple, but class 2s are not easy, okay? They're a simple concept, but they're not easy. To get that contact on point, to get that emergence on point, to get the occlusion on point is not easy. And it can take time, and often when we're training, we're trying to rush through things. So what it looks like for the first few years is not necessarily learning new things, learning how to do veneers and onlays and that kind of stuff. It's just everything that you're taught at dental school, but now you're doing volume and you're trying to become better at just the basics, better communicator, winning patients over, being nice to them, caring for them, genuinely caring for them. Diagnosis, treatment planning. So my plea to all the dentists entering the big bad world is forget the fancy stuff you see on Instagram. Just focus on your bread and butter, and those foundations will really serve you well. Even if you know that in the future you want to be a cosmetic dentist or whatever that is nowadays, still make sure that you can extirpate well, you can extract well, you can do an atraumatic extraction, you know how to section eventually. If you do those things well, you'll be absolutely golden for the future.
Yeah, so just, take your time with it at first, and then that hopefully niche will come later on down the line.
Yeah, you don't need courses and that much, unless it's a really good deal for FD. You get so many weekly programs set up for you by your trainers that covers your extra education. Then there's always things you can watch, and let's say you got a crown prep the next day, there's stuff you can watch, there's videos on Protrusive or on YouTube that you can just check and just be get in the zone for that. And there's something I refer to as just-in-time learning, right? So, Emma, if I was to tell you tomorrow, can you do a crown lengthening procedure, a functional crown lengthening on an upper premolar? Could you do it?
No.
So you can't do it. You don't know much about it, okay? Therefore, should you get the textbook and start reading about it?
Yes, if I'm going to do it tomorrow. Yeah.
In theory, yes, you got it. If you can do it tomorrow. Okay. But here's the thing. Don't start reading about C-shaped canals and endo and all these obscure things, which still count as foundations, endo and perio and that kind of stuff. Whatever is actually, look at the cases you have, look at the diagnoses you made, look at the procedures you have in the coming weeks, and then focus on just-in-time learning. So what is it that you need to learn now to make your restorations or crown prep better or extraction better you've generally got tomorrow or next week? If you do that, you'll learn so much more than just randomly in a misguided way learning this technique or that technique and not getting to implement it or actually use it.
Yeah, which I suppose is very different to what I'm used to at the moment, or probably last year when you're doing exams and you're cramming all this information in. But it's hard because you're not able to use it yet. You're not able
you'll
to
learn.
use
You could identify a keratocyst better than I can. Right? If you had an OPG and it was is this an ameloblastoma or a keratocyst? I'd be I have no idea. Stick it to AI, ask Google, and you'd be yeah, that's ameloblastoma.
Yeah.
Its features are X, Y, and Z. Keratocyst, the incidence is 0.2%. It's X, Y, Z, or whatever, right? You'd know that, right? But guess what? You ain't going to see one for about 15 years. And so do you need to know it? Yes, of course. As dentists, we need to know that stuff, right? So it's important. You wouldn't trust anyone in their profession who doesn't know all the range of pathology, right? But you know far more about it than you should in a way, because you're not going to be managing it, nor you're going to be diagnosing it anytime soon. But the actual practical skills, right, that are lacking at the moment, right, because of lack of experience, that's what you have to develop.
And I suppose that then transitions into, I've been needing an hour and a half for whatever procedure I do at dental school. You need everything checked in between, blah, blah, blah. But I suppose when you move into your own chair and your own room, going from needing that hour and a half to half an hour, 20 minutes, whatever you've been booked in, I guess that comes back to what you're saying, you can focus on the things that actually matter, and that's how you get better. Because it's an intimidating thing thinking that, I'm going to go into this practice in September and my times are already going to be cut in half, I know that they will have longer appointments for me, but that pressure is then on to start chopping that back. But I suppose then, I know what to focus on, what to cut out, forget about cysts for a while until I need to know them again. And I guess that's how you just become more competent. But
well, you're going to have a nurse, right? Before, at the moment, it's you guys have students nursing for each other. So you're going to have a proper nurse, right? Which helps in terms of timing. You're going to have autonomy. You don't have to get every single thing checked, right? Every single phase, right? So that will cut some time, but please fight for an opportunity for the first 3 to 6 months just to have extra time. If you can finish with 5-10 minutes to spare, just to reflect on every procedure, that would be ideal. Like, I know what I'm saying is a little bit like some trainers be like, no, that's unrealistic. We can't do that. We have targets to meet. And I get that. But if you can somehow, like if you have a supportive enough trainer that can allow that, or if fortunately in a position that can allow that to happen, then focus on getting fast in the future. Just focus on getting good first. Get focus on really spending maybe an extra 5 minutes on the contact point, right? When you got the matrix in, and instead of spending 5 minutes, you're going to spend 10, 15 minutes on this one important critical aspect, and just noticing, okay, well, if I put the wedge in a bit more, okay, the contact might get a bit tighter, and you get to do it on a rubber dam and do it properly. It's so, you know what? I just remembered the first ever episode of Protrusive, right? It was about moving Singapore, and Surinder, the dentist, and she's so lovely, and she said this really interesting thing. We just generally talking about dentistry. She said, you lose your standards so quickly. You start cutting corners so quickly, right? Because, someone will say, you don't need to do that. That's academic, that's uni stuff. Just do it this way. It's so much easier. And then you do shortcuts, okay? And sometimes those shortcuts are hacks and they're generally good. Sometimes those shortcuts will have a compromise in quality. And so you need to educate yourself on, okay, what is a hack that can get you the same quality or near about same quality result with less time and less steps, versus actually you're cutting corners because you're making things cheaper. And then you need to realize, okay, what kind of practice, what kind of dentistry do you want to practice more? Because if you start practicing cutting corners more and more and more, your neurophysiology changes, right? Your neuroplasticity changes. You get used to doing that, okay? So one thing I do in my life at the moment is when I'm knackered, when I'm really, really tired, okay, and I'm looking at my diary, like, okay, you know what? There's 2 episodes planned for next week and I haven't recorded any intros and outros, okay? It's so easy to say, you know what, I'll just do it another day. It's so easy to say that. Okay, but if you make a habit of doing that, your brain keeps learning. It grows that part of the brain which is weak. And so you need to resist the urge to cut corners and try and do everything as best you can. So what I mean in a real world terms is rubber dam, right? Learn how to do quadrant isolation, do the rubber dam school, a quick and slick rubber dam on Protrusive app, and go through all the videos and do rubber dam. Even if your nurse is going to roll the eyes and she's not used to doing rubber dam, it's okay. You've been a nurse before, you've been there, right? So do it, book some extra time, and then every patient, every restoration, do rubber dam if you can. And if you can, honestly, your portfolio by the end of the year is going to be so glowing, and you'll be an asset to any clinic in the future, and you'll be set up for any type of practice that you want to work in the future.
This whole section reminds me of when I seen you in London a year ago, 2 years ago, a year and a half ago, and I was speaking to Rakesh that we used to work with, and he was foundation dentist at that time, and he said he was having a great time because his trainer was just no pressure, was just letting him do what he wants, and the work he's putting out at the moment is fantastic, like absolutely fantastic. And his biggest piece of advice for me was, don't care how you do it, but when you go for interviews, things like that, try and find a mentor that will just let you do that, will let you have that freedom. Do rubber dam all the time, doesn't matter how long you're taking, but just explore the things that you want to explore. And I've worked in practices where rubber dam is just not a thing. It just isn't a thing. Even for root treatments, using Milton instead of Parcan, all this, that, the next thing. A lot of cutting corners. I think I've spoke about this before, dentists actually putting a clamp on the tooth just for the radiograph so that it looks like they were using rubber dam, but they weren't. So yeah, I think that's really interesting.
For me, I can't even go to sleep. I can't even my stomach turns when you say things like that. So you could easily get into this habit of just constantly cutting corners, and then you normalize it. Right? So please, everyone listening, everyone watching this, don't normalize, not even mediocrity, but substandard care. Don't normalize. Yes, you'll see more patients. Yes, it might mean you make more money or whatever, but in the long term, honestly, it's going to be a detriment, because if you do things by the book and if you do things properly and you're proud and you go to bed at night saying, you know what, I promise you, patients will be willing to pay for high quality dentistry in the future, and you'll be the one to be able to provide it. Because the people who are putting the clamp on right at the end, guess what? If something was to happen in the health system and all you're doing is private endo, right, and that's all there is, then who's going to be able to have the skills to deliver that kind of dentistry? It's the person who's been diligently going a bit slower, going high quality all the way through, and not being substandard.
And I think it's difficult because when we're in a university setting, if something's not going right, or if you need that specialist help, it's there for you, but in the real world, you don't always have that to hand. So,
hello, YouTube Protrusive. I know you're watching on YouTube, and I hope you're enjoying this episode so far. But I wanted to highlight, in case you don't know yet, we have an amazing viewing experience on protrusive.app, our website, our network, our platform. So I just want to spend a minute to show you what this looks like. On the left side, you see the navigation, and when you join the app, you get a 1-minute video tour of the entire network. Now, in terms of where the magic happens, that's in the Protrusive community, because you might come for the content, but you'll stay for the community of the nicest and geekiest dentists in the world. We have all these polls, we have a chat group, there's always active chats and dentists helping dentists. And really what I want to do is create a really supportive environment that's not like the environment we have on Facebook, and is built on the values of niceness and geekiness. If you are nice and geeky, you belong here. Now, to make this a safe space, we have a manual process of approval. We actually verify that you are a dental professional before you get in here. So we have hundreds of applicants a day. So if it's been about 2 days and you haven't heard anything, either something's in your junk or you need to reach out. If you're still waiting to join your tribe, email marie@protrusive.co.uk. That's MARI@protrusive.co.uk, and she'll investigate what's happened. Now, all the videos you have on YouTube are also on here, but you actually have some extra ones for free that you don't have on YouTube. So you get some bonus content that's not on YouTube. And actually for the future, I'm not taking things out of YouTube, but some things are not appropriate for the wider public, and I want to sort of safeguard that information, which is like dentist talk, if you like. So that's why a lot of the content is only here and not on YouTube. So you're kind of missing out if you're not on here. That's why I'd love for you to join there. And if you join one of our paid plans, then what you get is access to the CE quiz, like this one, and you can get CPD or CE certificates, and also you get our premium notes. So these are a great aid memoir or revision for an episode to really cement your learning. And whilst we have ads and YouTube places ads on YouTube, we don't have that on our network. So for the paid plan, you get to see all of the premium notes without any of the ads. And of course, you get to support Team Protrusive and help us to continue what we're doing. I'm just going to gloss over the Protrusive Vault, which has all our infographics and downloadables. These are all our masterclasses at this moment in time, and we're always planning to add more. And if you look at them, there's about 1, 2, 3, it's about 7 of them. But actually, if you look at the replay section, some of the live masterclasses that I've done and some of the training that people pay for on other websites is all on there, included as part of the masterclass subscription. And if you're a student, don't fear, we have a special section for you with all the student notes, which anyone can access. So for example, here is one on exodontia. So it's all there waiting for you on Protrusive guidance. Please head over to the website, which is protrusive.app. Make an account on your browser. This could be Safari, Chrome, however you want to do it. And once you've made your login, then you can download the iOS or Android app and then log in through there. So the reason to make the subscription primarily on the website first is that you get access to a free trial, which you don't get if you make an account on Android, iOS. If you make it on the website, you get access to the free trial, and you get our best price if you sign up through protrusive.app. So our best deals and free trials are only on protrusive.app. Of course, we always put the link below in the description, and thank you so much for enjoying our videos on YouTube. But it's now finally time to level up your experience. Back to the episode.
It's difficult learning when something is good enough and when to chase for perfection, but without cutting corners, if that makes sense. I think that's something that a lot of people will definitely find difficult in VT and DFT. So that's interesting.
And I just wanted to add, just make sure, and it was inevitable that I was going to say this in this episode, but make sure if you don't have access to a camera that's set up and ready to go, ring flash the whole lot, so you can pretty much photo every single patient every single time, ideally, then please get one. Right, so you have to take a loan or whatever, just get one. You can get a used setup for about £600, right, including the ring flash. And nowadays with the AliExpress and Chinese stuff on the market, it's cheaper than ever to set up compared to my day. So please, dental photography, if it's 3 things that you nail in your first year, is getting good at extractions and anesthesia. So powerful anesthesia, good predictable anesthesia, and good extractions that's atraumatic. Rubber dam isolation, because it's not rubber dam isolation itself, is what rubber dam isolation represents. Rubber dam isolation represents a ethos. It represents a way of doing dentistry. It represents care that you take. It represents standards. It represents so much, and it unlocks doors for you in a decent dentistry and overlays, onlays in the future as well. So it just represents how you do anything is how you do everything. So if someone's doing rubber dam, they genuinely are on the right path. Okay, so extractions, anesthesia, rubber dam, and then last one is photography.
Yeah.
Okay. If you can just focus on these 3 things, then honestly, you have a great portfolio by the end of the year. just from those 3 things. And then any challenge that comes your way in the future, you'll be able to use that sort of confidence that you built up to your advantage.
Yeah, and I think working with you over the last few years, that's definitely become a priority of mine, is photography over the next year and getting myself a camera.
Yeah.
We went
There's
to
a 21-day photography challenge, Emma. Don't forget,
yeah,
you were involved in that. So 21 day,
yeah,
in literally in your first 3 weeks, you'll be able to take every single photo, included the dreaded
yeah.
occlusive photos. That's on the app ready for you.
Yeah, and I'll need to maybe beg my parents to help me out for a camera for a bit.
No
But
shame in that.
no shame in that. We went to a conference, like the whole of 5th year was invited to a conference, and it was all the Scottish dental schools, and they were doing a giveaway for a really good camera setup, and I was like, oh, I really hope I win that. But someone from Aberdeen won.
Oh, damn you, Aberdeen.
But the next thing I wanted to ask you, Jazz, was earlier on in your career, and I know everything's a learning point, but are there cases that you took on which you wish you hadn't? Or like similarly, are there cases that you didn't take on that you wish you had? You know, where do you lie with that?
I think in life, you never regret the things that you didn't do. So it's like,
Mhm.
oh, I wish I'd taken that case on. It's difficult. Okay, so it's a great topic, right? You do sometimes want to start running. You're in the walking stage, but you want to start running. And then suddenly a
Yeah.
case comes along and you think, oh, veneers. This could be my first veneer case. And then you
Mhm.
suddenly you see the lights and you think, oh my goodness, I could do a cool veneer case. It'd be so much fun. But actually, the more you look into it, the occlusion is not appropriate for veneers, okay?
Yeah.
The patient expectations through the roof, and this is not a great case for, let alone your first veneer case, or even your 50th veneer case isn't a great case. So when you have that temptation as, oh, I want to do something for the first time, and that will happen a lot,
Okay.
doing this for the first time, doing that for the first time, right? You know, a lot of those first time moments will happen. It's great to be able to just take some photos and
Mhm.
then show your trainer and be like, hey, I have this case. What do you think? Because they will see things that you won't see. A good example of that is when I was dental school +2, I was working in a Saturday clinic while I was doing my DF practice, and I used to read these notes of a prosthodontist used to work before me. And then
Mhm.
I'd read his examination notes, and he had a column that said wear facets, and he'd label every single tooth that had a wear facet. And I'd look in the mouth, and I think, is this the right patient? Because I don't see a single wear facet. I did not. My eyes were not trained. Okay, they were
Yeah.
there. I
Yeah.
can see them easily all day. All day now, easily. I can see them with my eyes closed. I can feel them. But at the time, I just didn't know what I was looking for, right? And so you will appreciate how little you know. And so as soon as you start showing these cases to your mentors, the most annoying thing as a young dentist is that you'll realize that they'll give you reasons not to take cases on, right? You'll be frustrated, but please thank them. Say, thank you so much, okay? Or they might say, look, do it, but here are reasons not to do it. But if you do it, then do it this, 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 this. And then you have to decide, okay, are you at the right level? Do you have the right guidance and support to be able to take that case on? So whenever you're doing something the first time, please utilize that mentorship, that trainer opinion, which is really good. Going back now, are there things that I did that I regret I didn't do? Part of dentistry and learning dentistry and the practice of dentistry is mistakes happen and you learn. And it's like, no matter how much someone can teach you, until you make that mistake yourself, you're never going to learn, right? So simple things, right? I did a reservoir bridge for someone with a high smile line. She paid nothing for it. She was exempt, okay? She paid no money for it, okay? But when I put the RBB on, you can imagine high smile line, the way the pontic sits on the gum for a lateral incisor, you can see that. And it left a dark line just by the gum, okay? So that taught me, oh my goodness, yes, I didn't assess the smile line.
Yeah.
I was so focused on the bridge design and which cement I will be able to use to make sure this lasts, that I didn't even consider the pontic, the aesthetics, the high smile line. And then like the patient wasn't happy. And I was like, okay, I'm really sorry. I spoke to my trainer afterwards that, yeah, like, these are things that you'll learn over time.
Yeah.
You need to make sure you keep reflecting on those moments. And wherever, if I can go back in time, I would have shown the pre-op photos to my trainer and said, hey, is there anything I should think of before doing the Reservoir Bridge? I'm going to use Panavia, I'm going to do this. And then he would have said, okay, you said all these right things, but you haven't once mentioned about how high this smile line is. This is actually a
Yeah.
really high expectations patient. And be like, oh, okay. Well, she didn't say anything about her expectations. How do you know that? It's like,
Mhm.
well, look at her smile. She shows everything.
Yeah.
And then that would have been a light bulb moment. So instead of me learning through failure, it could have been learning through his failures, right? Because
Yeah.
we can stand on the shoulders of giants and learn from their experiences. So you will have those moments, you'll make mistakes. And that's one example I gave you just there of something that caught me out because I didn't diagnose the high smile line.
Yeah. And I think it's, it is daunting, but you've got to get into practice at some point. I think it's so overwhelming, all of the things that I I'm not used to yet. I mean, even my trainer Bobby in Campbelltown, you know, will sit and look through radiographs, and he's like, "Oh, do you see that? Do you see that?" And I'm like, I don't know what you're talking about. Like, I can't see anything because I'm
Yeah.
just not used to it.
Mm-hmm.
And
Your
I think
eyes
that's
not
where
trained.
yeah, they're just not trained. They're just not used to it. It's so overwhelming thinking about everything all at once. And again, I hope it comes back to just, you know, when you get into practice, you will learn what to weed out and what to focus on and what are
Yes.
your big hitters. And I think that's why I'm so grateful for, you know, the VT and the DFT that we do have in the UK. I was working a locum dental nursing shift, must have been like months ago now. There was this guy, he was from Scotland, but he trained in Milan, I want to say. And he came back, and this is his first year, but he doesn't have a trainer because they don't need to do VT. And I felt very sorry for him. Like, he was talking to me about his anxieties that he has. And he does have someone coming out to help him every so often and to talk over cases and things. But it just made me very, very grateful for the help that we have in the UK, and just having someone next door if you need them, if, you know, to talk over cases, if you can't get a tooth out, this, that, and the next thing. And even spaces like Protrusive, you know, chuck photos up on there, see what everyone else thinks. I think it's a great thing. That sort of lessens the anxiety a little bit.
Mentorship is now everywhere, and you raise a great point. Mentorship really helps to reduce your anxiety and your stress, and we need more of it earlier in our career, and you keep needing it. So it's a great point you raised, and I think to find those mentors ASAP is a recurring theme of the podcast. Just the other thing I wanted to mention about mistakes I made that I reflect on now is on a broad scale. Imagine, Emma, that you diagnosed a lot of caries around an existing MOD amalgam. And the plan is to stabilize the caries, remove the amalgam, and let's say do a GIC or a composite or something to stabilize things. Okay? Sounds fair?
Okay. Yep.
Okay. Right. I'm the patient, you're the dentist. Okay. Tell me about this procedure and any risks that I should know about. Just generally, like, tell me what you've diagnosed and what we're gonna do about it.
So is the tooth vital? Is there
The tooth is vital. It's a deep amalgam, and it's got caries
amalgam?
now.
Okay, so you've got a silver filling in your tooth that's really quite big. It's sitting close to the nerve, but there's
Oh,
some
have
decay
I?
around
I
it.
didn't know I had a filling there.
No, didn't have any pain there, no.
No, I didn't know I had a filling, let alone, yeah, a problem with it.
So no issues, no problems with the tooth, okay. So there's some decay around that filling, which means there's been bugs and things getting in there, and it started to rot away some of the tooth around it, which isn't good. So if we let that progress, then it could get worse, and eventually the tooth could become painful, and then at that point the tooth may need extracted, depending on how bad the decay is.
No, I definitely want to keep this tooth.
Want to keep this tooth. Okay, so we could go down a more proactive approach. So at the moment you're not having any pain or issues, but one option that you do have is to go in, take away some of the filling that's in there and any decay around it, and we could sort of almost stabilize the tooth in the meantime with a temporary filling to see if everything settles.
This sounds really expensive, Emma. This sounds really expensive.
Sounds really expensive. I actually don't know how much that would cost on the NHS.
Okay, carry on.
Again, one thing we don't really.
Yes, okay. That's the whole thing you have to learn in general. But okay, so I've said, okay, you've said that. Okay, it's going to cost this much, and okay, fine. Okay, fine. All right. I guess if I need it, I need it. Okay.
If you need it, you need it. But with every procedure comes along some risks and some benefits. So benefits, I suppose, you get to keep the tooth long term. We get to eliminate any disease that's in the tooth. But risks, if we go into this tooth, you've got quite a deep filling there, and it's sitting close to the nerve of the tooth. And whenever we take drill to tooth, there is a possibility that we could irritate the nerve of the tooth. And if that doesn't settle for whatever reason, which could happen, we could end up having to do a root treatment on that tooth, again, which is going to cost more money. I don't know how much money, more money. And then we go down the route of, you know, if you have a root treatment, I would speak to the patient about cuspal coverage restorations. Yeah, which is a tricky one to navigate.
I'll stop you now. So well done, Emma, because I put
there
you on the
is
spot
so
there.
much to navigate. It's overwhelming.
Exactly. For one tooth, you see what happened there? For one tooth, there was so much to discuss, right? And so you made the same mistakes that I used to make, right? Firstly, did you feel a little bit awkward or worried about discussing the risks, the fact that it could turn non-vital? Did you feel a little bit worried about that?
Yeah, because I think it was you I was speaking to before. It's almost like you feel like you're taking on ownership, and it's my fault if it's going to turn painful or whatever, non-vital, but like you didn't put the decay there. It's a lot of pressure.
yet again, when you were talking though, despite knowing that when you're talking is like, oh, we could irritate the nerve. Listen, we're here to help the situation, okay? It's their grotty situation, right? They got themselves into this mess. We're here to rescue, okay? So one thing I wish I'd learned sooner, which I'm happy to pass on now, is you need to make sure they own the problem and even the words you use, okay? So it's not, you know, there's not a decay in the tooth, there's decay in your tooth. Your tooth is really decayed. It's close to nerve. What we're trying to do is CPR for your tooth. This one has got very high risk of needing a root canal where we have to remove your nerve, okay? So there's a very high risk of doing this because your tooth's in a grotty situation. I'm gonna try our best to save it, but it doesn't look great. But I still recommend trying our best to save it, although your nerve could already be quite compromised. If that happens, and blah, 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 but you see that difference in language, like, okay, yeah, your tooth, your problem, okay, and there is a high chance it can happen. We could do nothing, but you're definitely gonna lose your tooth that way. But should we do the dance, we'll try our best, but your tooth, it might already be too late. Right? Do you see what I mean? I'm really managing expectations in a high risk scenario and get them to own it rather than, oh yeah, you said you might irritate the nerve. Looks like you did irritate the nerve because I had no pain beforehand, but now I do. So you need to really make sure that in that scenario, you really nail it because you spend all that time in care. And if the patient thinks it was your fault because they had no pain before, right? Then you need to make sure you flip that narrative.
I think that's something I really struggle with because I'm such a people pleaser and like, naturally you want people to like you. And I think, I can't remember.
They can still like you, but you can still give them the God's honest truth that, hey, your tooth is, you know, just be very, not blasé, but like, be like, hey, your tooth's in a really bad scenario. Did you know that? Oh my goodness. Yes. Okay. Well, we'll try our best, but it's a very compromised scenario. You know, just like that. Just got to be in a situation whereby you can get your point across without taking yourself so seriously and making it constantly reiterating, like, you know, you constantly said in that scenario that, okay, you don't have any pain at the moment. Okay, you don't have any pain at the moment. When we're communicating this, we need to not focus on the fact that it's asymptomatic. We need to focus on the problem. Okay. That's a really important thing to do because otherwise all the patient hears is there is no pain. Oh yeah, she's reinforcing there's no pain. So you're gonna be like, hey, your tooth's in a really dodgy scenario. So that's just one example. We can do this all day long. I've only got a few minutes left of this version of the podcast today. Any final burning questions?
So final question, Jazz. How do you deal with patients who don't want the ideal treatment? Like whether it's money related, because in dental school, you know, our patients get everything for free, or they're worried about the benefit, the risks. Sorry, if they're worried about the risks, you know, how do you deal with that? Comes back to consent, but not something I've ever really had to deal with before.
You first need to establish what is their goal. If you're not sure what their goal is, you need to keep asking. Okay, so you don't ask what is your goal because that's not going to make sense to them. So let's say they come in and they're missing a tooth. Okay, you need to ask, okay, why do you want a tooth there? Okay, what would it mean to you if you had a tooth there? What do you want it to look like? Okay, how long do you want it to last? Ask these questions. When they tell you the answers to that, because of the way they answer the question, you already know what the treatment is.
Right. Okay.
Because if they say I want something fixed, I don't have to take it out. If they said they want something really aesthetic, and if they said all these things, they want to be able to chew with it and eat hard things with it, you know a reservoir and bridge is probably not the best thing to go. So they're looking for an implant. Okay, so then you relate back to them, okay, you want this, this, and this. Based on this, my recommendation, because you're allowed to make a recommendation. Please don't think that you're supposed to give them 5 options, let them choose one like a bloody food menu, right? You got to say, hey, there are 5 options, but based on what you said, the recommended option to meet your goal is option number 3. This is what it is. There's the benefits. This is what it's going to do. This is how long it takes. It costs this much. There is do nothing, but I don't recommend that because it's not going to meet your goal. There's a few other things we could do, but that doesn't meet your goal either, although I can talk more about them. And really, you need to guide them, right? So instead of talking through 15 different options, you need to listen to them and find out. It's like playing, I said this on another podcast I did with Michael Frazis. It's like playing Guess Who. Right? You know, when you play Guess Who, you keep knocking things down. So let's say you got the whole board of people, board of treatments. They say something, you knock all the ones down. They say something, you knock all, and there's only 3 people left at the end. It's like, okay, actually, based on what you said, there's only 3 good options. The one I recommend is this one, and talk about it. And then you can talk about the other 2, rather than talking about every single person on that board.
Yeah. I think that's definitely a way to make it less overwhelming as well. Because we're taught so much about informed consent and blah, blah, blah. But like you're saying, a huge part of that is giving your professional opinion and you know, because a lot of time it's quite frustrating. Patients will go, well, what do you think? Do whatever you think. It's like, well, I don't know what I think. You know, I'm giving you the options, but yeah, that is something that.
No, you need to get. You know, so here's a common misconception, right? You know, when they put it on you, right? You're allowed to say that, hey, look, the reason I would choose this is because this is, I value A, B, and C, and I value long-term health. That's why I choose this. But based on what you said, yeah, I agree that it would actually work well for you. Or you might say, no, based on what you said, though, the fact that, you know, you might be losing other teeth soon, I probably recommend a plastic denture, even though the metal dentures are better or whatever. But for your time being, this is what I recommend for you. And really make it bespoke. And I think that really is the secret.
Yeah, yeah. Which is, again, really difficult to get used to having these conversations. But I'm going to have to get used to it at some point because it's coming in hard and fast.
It is, but you know, the more you do it, it's like the reps, okay? And the more you do it, the better you get. And if you're not sure, just take photos, be like, hey, you know what? This is a really challenging case. You got this, you got that, you got this. Let me discuss it with my colleagues. We all come together, we discuss these cases. Is that okay with you? So, oh, yeah, sure, great. Okay, we'll see you next week for a 15-minute review. We'll have enough information to present it. And sometimes having that time to collect your thoughts and put a nice plan together, maybe even like a handout they can give them. Say, okay, here's your bespoke treatment plan. Everything's written there. But it's like when you do an extraction, you give them the written plan, but you also give them verbal. It gives you an opportunity to just run through it with them and say, hey, everything I have it here as well. Is there an option that sounds particularly suitable for you? And let them talk. Let them just say what they think.
Yeah. I used to work with a private dentist. He done implants and things. And whenever he had someone in for an exam, he would book them back in for a video call the week later, and he would have he would have a presentation and he would share a screen and he would add radiographs up and everything. I think that's a great idea.
Yeah, I do that as well, but I do it async via Loom. Like a software called Loom. We have Loom School on the app now, so I do it without having to sync a time, without taking diary space. Shoot a 5-minute video, say, hey Emma, thanks for seeing me. I know you're interested in your smile. Here's your photos. Based on what you said, here's my recommended plan. Because you said you wanted this, I'm not going to recommend ceramic because of the X, Y, Z, or I'm not going to recommend composite because you said you want something that lasts as long as possible. Here are a few examples of what I've done before. This how much it's going to cost to get started. Here's the deposit you need to pay, and here is the treatment sequence. And then they watch that, and then they share it with their spouse or their parents or whatever. And that's a really good way to not have to do what we call shotgun treatment planning, right? Shotgun treatment planning is that you diagnose and on the spot, be like, okay, we're going to do this, this, and this. It's going to cost that much. And you're like, blah, verbal diarrhea. I was never good at that, ever. That's why Loom video, it just suits me.
Yeah, I think that's good. And I've not heard of anyone doing Overwhelm, and then you don't have to take that time out of your diary, definitely.
Yeah. And then they can watch it over and over again. It's wonderful, honestly. So for those of you intrigued, check out Loom School. It's on the app. It's on part of the Ultimate Infinity Plan. Loom School is there for everyone to learn exactly how to do it. You get 90-minute CPD. It's like 15 bite-sized lessons, and it gets you to it. But Emma, all the best for the final few weeks of dental school.
Thank you.
Really great questions today. I'm sorry for putting you on the spot, but also not sorry because I think it helps you grow, and some people would have resonated with that, which is great. I don't know if we're gonna have to, what are we gonna do now? Protrusive students, it's not gonna be apt anymore for protrusive students. So we might have to do a newbie dentist something. We'll have a chat, okay? We'll have something because I think the most exciting thing is that you're gonna have new questions in your first year. Oh, we'll have this case. How do we do that? And we could do like a live mentorship thing, which would be good for you, but also good for everyone else. So let's keep in touch about that.
Perfect. Thank you very much. It's been great.
All right. Thanks, Emma. Well, there we have it, guys. Thank you so much for listening all the way to the end. Aren't you proud of Emma and what she's achieved? And we're all rooting for you, Emma. Thanks for all the wonderful work you've done with Protrusive over the years. It's been great to cover these student series with you. But of course, now we need a new Protrusive student. If you think you know a student who's keen as Emma and is looking for a bit of part-time work, get an income while studying, and contribute to Protrusive, then please let me know about them. The best place to let me know about them is through the Protrusive Guidance app. Please DM us. Please DM me or Alex or Marie or any of Team Protrusive. We're here to help. Or maybe you are the student listening to this and you're super keen, and because you've come all the way to the end of the episode, you're exactly the right kind of person. Please do reach out. We're looking for the new Protrusive student. It could be you. For all us qualified dentists, you can be getting CPD or CE credits for this episode. We are a PACE-approved education provider. Just scroll down below if you're watching on the app, answer the quiz, get 80%, and our CPD queen Marie will send you a certificate. All episodes come with premium notes, which are downloadable PDFs. And there's also the Protrusive Vault section with all the guidelines, PDFs, infographics that we've been creating all along, all in one place. It is well worth a subscription, so check out protrusive.app to unlock CPD from the episodes and all of our masterclasses. Thank you so much once again, Protrusive. I'll catch you same time, same place next week. Bye for now.